Health and healthcare has been the center of my life. It is my desire and ambition to help as many people as I can while I can. The way you do that is you get with other like-minded people who have similar ambition and shared values. And so the foundation just gives me an opportunity to do more good for more people. One is to bring the perspective that I have as someone who's practiced, someone who's worked in academic and non-academic environments, someone who's worked in the community, and to bring that perspective into our board and committee conversations. We've got to have the right communications and the right conversations. We've got to work through trust and trustworthiness to also be able to go out into the community and promote the work that we're doing and the difference that it makes, not only in those who receive direct care at UT Southwestern, but those who actually receive care at other sites and facilities that we contribute to in some way. My experience as the COVID czar over health and healthcare was incredibly humbling, rewarding, and also at times deeply frustrating. The role of business and the role of government and the role of non-governmental institutions and individuals, all those things were playing out in a very public way. I hope that the lessons that we learned during the height of the pandemic are not lost. Hopefully, that leads more of our citizens and more of our leaders to say, we really can't neglect public health because at the moment of a crisis, that's the wrong time to try to build it. Beyond just health factors, some of the social factors, housing, the density of housing, the availability of nutrition, resources, and other things to be able to manage sheltering in place, the ability to actually work from home. Those are socioeconomic, not just racial. And so I think we have to be mindful of each of those. And we also have to be mindful of the common theme, which is our society only functions if our society functions. When we got to this essential mark, we saw just how dependent we were on communities that we may not have paid as much attention to. And I hope that one of the outcomes or lessons from this is that we pay more attention to that and we develop understanding. That means that everybody has a role and a contribution and participates. My wife and I now have been in Dallas for 12 years this year, and this is truly a place that we call home. It is remarkable how broad, diverse the community is in experiences, perspectives, backgrounds, ethnic mix. The caring and concern for others is here, and we're seeing that play out. The can-do spirit is incredibly strong. We have brilliant people who have proven that we have an entrepreneurial and innovative spirit. We have a jewel here. And as we continue to bring more of that into the ways that we look at health and healthcare, the ways that we look at individuals and populations, the medical community, the research community is phenomenal. And from here, we can make a difference, not only in Dallas and not only in DFW, but across Texas and across the nation and the world. I can't even imagine what we are going to do and the change we're going to create. We're a resource-rich community that has the right spirit, that has the right intellect, and has the capacity to change so many lives for the good. We certainly have to continue to evaluate current therapies and interventions. We have to continue to pursue innovation. Viruses, bacteria, disease states, conditions continue to evolve. We're seeing that play out now, going from alpha, beta, delta, omicron of COVID. We recognize they evolve, and we actually have to have science and research, clinical trial participation and involvement so that we can continue to respond to, predict, and get ahead of some of these things so that we can promote the health of the overall society. I think we've obviously determined locally and within the state of Texas that it's incredibly important that we focus on public health, but I think that we still have to figure out how that plays out through the rest of the country and across the world. I approach things from how do we actually make a difference? It's always been with an eye on the patient. So that's what I hope that I achieve in my volunteer capacity for Dallas.